Hi, I'm Damian Tarnopolsky. I'm the creative lead at the Narrative-Based Medicine Lab at CPD, the Faculty of Medicine at University of Toronto. And I'm delighted to welcome you today to an informal conversation about medicine, narrative-based medicine, and literature with one of our advanced certificate participants and foundational certificate graduates who's visiting us today from Ireland, Miriam Colleran. I'm here with Karen Gold, who's going to begin the conversation with Miriam.
Thanks, Damien. Hi, Miriam.
Hi, Karen.
It's so lovely to have you in Toronto.
It's wonderful to be here.
Absolutely and to be wonderful. Able to meet you in person after so much virtual contact.
Oh, it's fantastic. It's absolutely fantastic altogether. Yeah.
So can you start out by telling us a little bit about yourself and the work that you do?
As Damien mentioned, I'm a doctor at home in Ireland. I'm over here at the moment on a conference, which is wonderful. Well, I qualified in 1994 and did a lot of hospital work first, and actually including hematology, which was about 6 months in hematology, which obviously was working with patients who predominantly had leukemias, had blood cancers, sadly, and it was very challenging work. Mm-hmm. It was very challenging work, but also very rewarding. It was and we also got to know our patients extremely well, because they would come in and sadly live on the ward for months at a time, so, and often for infection control reasons, they had very little family contact. Mm-hmm. And even then it was kind of in the era before we had smartphones. So it was very hard on patients. They were very disconnected from their families when they were so extremely ill. But it actually really struck a chord with me. It really struck a chord with me. And I did some geriatric medicine, and I actually did a year in Wales doing, as you call it, family medicine. We call it general practice, So about a year or two late, I did a little bit of public health after that when I came back to Ireland. And then in the back of my head was palliative care. It was a developing area in Ireland at the time, and I've been practicing full-time in palliative care since 2001. A mixture in multiple places in Ireland. As we do our training scheme, we have to move around. So, and now I practice between a hospice, which we use hospice to us and palliative care we use them as synonyms. It's different in the US. So I work in a specialist palliative care unit at hospice. I'm a consultant there, as you say, attending, and also in an acute hospital. So it's a lovely mix. And I work very much as part of a team, work with fantastic nurses, other doctors in training. Actually doctors who are kind of, some of them are training to be general practitioners, and others are actually interested in palliative care, although they're not part of our formal training scheme. And I work with a brilliant team, and interdisciplinary working is really important to us in palliative care, because we all bring different skills and we all see different things and notice different things. And that whole, you mentioned 360 before, Karen, I've heard you talk about it, but palliative care is like that. It's the whole person. A person may have a diagnosis of an illness, of a disease, but they experience an illness. So it's how it affects the person in their full lives, and that's really what we focus on in palliative care.
It's so interesting to hear your journey to be a palliative care consultant, because I think in our experience, there's such rich resonance between narrative-based medicine and palliative care, as well as all fields of healthcare and medicine.
Sure.
Yeah, we have all kinds of participants from that background and are seeking to apply narrative approaches in that world.
Yeah.
Could you tell us a little bit about that, about your introduction to narrative-based medicine, and as well as your experience in our
absolutely
lab?
I'd be delighted to. So I suppose, like everybody, in the earlier phases of COVID and acute COVID, we were so restricted in our interactions with other people that I started looking to online, really, And I happened to come across a tweet from Columbia about their basic workshop, and I actually hadn't really heard about narrative medicine before, or narrative-based medicine. I thought, oh, that looks very interesting. I'm going to be at home all weekend anyways, And I was just, I found it hugely interesting, a really different aspect to narrative to medicine, to what I had experienced before that. But also, like a lot of people, I've been concerned about how medical medicine, obviously evidence-based medicine, is hugely important.
Mm-hmm.
And we're all very grateful for all the rapid advances that have happened in medicine,
Yes.
particularly in cancer care, in most conditions. And because of that, people are living so much longer. But they're also living longer with a lot of complexities for many people, and with multiple illnesses, So actually, patients their illnesses are much more complicated now than they used to be. When I'm thinking of at home in Ireland, people often can live away from their families, or our parents. Sadly, both of my parents have died, but people are juggling so many responsibilities that when someone is very ill, it can be hard juggling even more responsibilities, and that social aspect of people's care. Well, that's their life, how their disease affects them. And so that's really what attracted me to narrative-based medicine, was it's seeing the person and whole person care. And someone isn't just someone, it really, I don't know if it happens over here in Canada, but at home, unfortunately, sometimes people get referred to by their disease, and like it might be introduced, and unfortunately it's referred to as a person maybe said he is a lung cancer, or and and I can feel myself, and I'm sure I did it. I'm sure I did it. But of course, that person isn't a lung cancer. He's a person. He may have whatever illness. And so I suppose narrative-based medicine for me and there are other ways, like the Whole Person Care Conference that's happening in Montreal this weekend in McGill, but it's an aspect of that dignity of the person, and recognizing that patients are people. They're people first, and it's how their illness affects them and how they're experiencing their illness. So narrative-based medicine has hugely resonated with me on keeping the focus back on the person.
Yeah, and I think I can already hear you practicing it already, in that attention to the painfully reductive name.
And it's done innocently. It's not done with any, but it's that depersonalization that's so concerning,
And I also hear so much that sensitivity to language, which you're talking about, conflating the person with the disease, and how narrative-based medicine draws our attention to language.
Yes, so much so.
Yeah, sort of a core thread that runs through, whether it's the way that you communicate with patients or families or colleagues, or how it shows up in your own writing or your teaching.
Sure.
Yeah.
And what you're saying there, Karen, is so important, because unfortunately we know that in healthcare that a lot of complaints are actually because of communication. So if we can communicate better, hopefully we know that healthcare professionals actually and clinicians actually enjoy their work more. And that obviously affects the outcomes, the patient care outcomes, which is hugely important. But actually, I suppose in my other hat, I'm a caregiver, a family caregiver as well. So it's given us both experiences in our household, unfortunately. And language is just so important. And that's a key to palliative care. We know that in palliative care, that if loved ones feel that their family member or their loved one was well cared for, they will cope better in bereavement. Yes. None of us want someone we love to die, but actually people need to be heard and have their concerns taken on board. And for me, narrative-based medicine has just given me so much help in changing the way I communicate.
And what I've also recently learned about you is that you have really wide-ranging interests within narrative-based medicine that I wasn't actually aware of. I know about your interest in writing, reflective writing. I know about your interest in using it in your teaching
Yes.
with medical students and learners. But I've also recently learned that you're also interested in some of the work coming out of narrative practice and using it to learn ways of communicating with patients and families that are more helpful.
Yes, and I'm very lucky. I've been to two, and obviously Dr. John Lawner in the UK has very much been at the forefront of developing narrative practice. And while narrative-based medicine really is kind of learning from the medical humanities and a humanities-based approach, and helps us improve our communication that way, and also actually coping with the challenges of medicine. Narrative practice and John Lawner, Dr. Lawner's group are called Conversations Inviting Change. It's very much focused on the actual therapeutic conversations and really about how to listen more and also caution in the language we use. Everybody's busy at work, so it can be, unfortunately, and probably unconsciously, we can cut down conversations by using closed questions. So with narrative practice, it's very much about opening up and letting the person share their concerns, And the research shows us that actually, as doctors, we interrupt patients terribly frequently after about 17 seconds, which is quite damning.
Yeah, I've had 8 seconds. I've also seen 26 seconds.
26 is hopeful. We'll go with 26.
That would be good. I'd love to get 26 seconds. Yeah.
But then if a person is actually allowed to speak, they actually tell their story in about 90 seconds, So I suppose narrative-based medicine is a wonderful tool, in my opinion, for helping us as clinicians to enhance our communications and skills and maybe to hone them in a way that's more person-focused.
Is that something that you've seen and implemented and experienced with your patients and colleagues?
As you mentioned, I've actually been doing quite a lot of courses here. So actually I'll backtrack a little bit if that's okay, because initially I heard about narrative-based medicine through Twitter and through the Columbia course. And once I finished that weekend, and it was an online basic workshop, I just went online saying, how can I get to do more courses? And that's actually what led me to the narrative-based medicine lab and finding out about the University of Toronto's Temerity's courses. And it's been just a wonderful experience. Yeah.
And as well as studying and implementing and pursuing, you're also creating and pursuing your own creative and literary activities. You recently published a couple of poems, I believe. Could you tell us a little bit? Well, first of all, congratulations.
Yes, thank you so
wonderful
much.
news, and we're really happy
thank you so
see
much.
them. We'll be putting them on our website if you can as well.
Very much.
But we'd love for you to tell us a little bit about those, about where they came from and what your process was like and what it feels like to see them in the world.
Oh, absolutely. Thank you so much. Well, actually, I wrote, when I say few, I mean, gosh, less than a handful as a teenager of poems, and then that was it really, but through narrative-based medicine, actually, I've been finding it a very helpful way to process the complexities of clinical practice, and also just, I suppose, in palliative medicine, obviously we work with grief a lot, grief and loss, and even changed life expectations for patients and their families, and we see younger adults than people would expect. Most people anticipate living a long life until they're elderly. And so I suppose we have, in practicing palliative medicine, you get confronted with mortality all the time. And it's a privilege to get to do what we do. It's a privilege to get to support patients and families at such a challenging time. We are focusing on palliative care this morning, aren't we?
Well, we're focusing on you, so
but we're all human, and it can strike a chord. It could be that somebody. I mentioned, I think, that both of my parents have sadly died, and So it could be that somebody reminds of your own lived experience, or actually it could be just having a bad hair day and it's just a bit tougher day at work, and actually mightn't have eaten enough breakfast this morning, and it can just, we're all human and work can take its toll. Or even just getting to work can have taken its toll, So, and I have found narrative-based medicine a great way of helping me process that, because of course that's my issue. That's not about this patient and their family. And when we're with them, they need to be the focus. So I have found narrative-based medicine a huge way to help me to deal with that, actually. And with the courses I was doing with you in the narrative-based medicine lab, there was obviously the theoretical aspects, but there was also the very practical aspects and the reflective writing, which I found hugely enjoyable. And then the small group work, actually, where we would get to share with one another. And it's just been a fantastic experience. And I was really delighted to get 2 poems published recently. And one of them actually, one of them is about our experience after our dad died, and he was a funny man. He didn't realize how funny he was. He didn't realize how funny he was, and he could say something completely innocently. And it was just so mind-blowingly funny. It was just so it actually, writing the poem actually brought back very sweet memories and helped stop the memories stopping being so sad, and then the other one that got published, so that was called Differently, and I'll read it in a moment if that's okay. Yeah. And then, and both of my parents actually died of rare cancers, so it has helped me a lot actually writing. Right, but I check with my family first. I have 3 older brothers and a younger sister, and I send it to them. We have a little WhatsApp group, and I send it to them first. Kind of go, is it okay if I submit this to something? Just to make sure they're okay with it. And the other one was actually our experience. It's called The Cherry Blossom Tree, and it's actually a number of years after my dad died. We eventually sold the family home. And of course the family home meant a lot to us. But the new people, their vision may be different to what we wanted, or to our vision, and it was their home now, so it was their choice to do whatever they wished. But there was an amazing cherry blossom tree that was obviously part of our childhood, and even the cherry blossom tree got cut down, and I was surprised the impact it had on me. But it was just another thing lost of the era of my growing up and my parents, and so. That's what the 2 poems are about. Yeah. Yeah,
it's interesting that both of your pieces follow that thread around grief and loss, that, as you're saying, is also a thread in your work.
Yeah.
As well as the privilege of working with patients and families during that time.
Yeah.
And your poems sort of express that in a very personal way.
Yeah.
But there's resonance with your work as well.
Yeah.
And you had mentioned to me that one of the poems actually had their start in one of the programs.
Yes, absolutely. Differently.
I was really thrilled to hear.
Yeah, Differently had a start. I started with Differently in the foundation and tweaked it a little bit, but yeah, absolutely. It started in the foundation, and it's been in the foundational certificate, and it's been enormously helpful for me. And now I'm just enjoying it so much, actually, and reading different poets. And this is a lady I found during the week. I found her and I bought a second book within a week, Courtney Peppernell, and it's just really interesting, She's a mix of kind of prose poetry and different styles, and just really resonated. And a lot of what she's discussing is acceptance and love and grief, but also how we still carry that person within us in a different way. So really enjoyable, actually. Yeah.
And I think you purchased some poetry
today. I did, yeah. I nipped downtown to walk around Toronto a little bit, and I got a Mary Oliver book and an anthology. Yeah. Yeah. So plenty reading for this evening.
Yeah. Lovely.
Yeah.
Can I just ask you, you've spoken so beautifully about the impact of this work, the transformative qualities of this work. And your own creative work, but you've also touched on some things that are sometimes challenging with narrative-based medicine. You mentioned writing about complex professional
Yes.
situations
Yes.
or
Yes.
patients or
Yes.
colleagues. You mentioned something that we brush up against repeatedly of
Yes.
requesting permission and discussing with your family
Yes.
if they're okay with
Yeah.
you
Yeah.
sharing a story
Yeah.
that they were also participating
Yes.
in.
Yeah.
Are there questions that you have about this work, or do you see challenges or things that you're looking to explore more in this context as you go on?
Sure. And I can see where you're coming from, because particularly, I suppose, and we don't exist in, no man is an island is what is obviously coming to mind. And James John Donne, that what we're, these stories that I tell or that I've started, they're not just my stories. They're stories of interactions with other people, whether it's my family and particularly in a work situation, it's so important for unless the person has given consent. And I'm sure you obviously have read the literature that's beautiful. That's a shared combination of the person who's experiencing sadly the illness and maybe their family member or a healthcare clinic provider or a clinician. And that can be particularly powerful, those stories, when it's sharing multiple different aspects of the same experience and how the different people involved perceived it. But it's so important, actually, to my mind, actually, which I think is what you're alluding to there, Damien, is the confidentiality aspect and actually that it's a privilege to get to work in medicine. In my opinion, it's a privilege to work in healthcare. It can be really tough, and COVID has been a very challenging experience. But actually, it's such an important role working with other people that we need to be very careful not to. They're not a story. And I suppose what's coming to mind to me is, actually, I mentioned a while ago that I'm a caregiver, and my daughter has a serious illness, and I remember this wonderful doctor, and I still think he was a wonderful doctor. And she had been very ill, and I'd managed to get into the hospital to her, and like, the backstory doesn't really matter. And then he said, "Oh, it's so interesting," and I thought, "Oh, no, it's not. It's not interesting. She's my baby, you know." And he was being kind, and what he said came from such a good place. Do you know, it was that going into an academic mode, and I was thinking, but no, this isn't interesting. She's my little girl, you know. So I think narrative-based medicine has helped me an awful lot with that, in terms of we're dealing with people. And how do we support them as much as possible? And that's not just about medication, but also about us. How is their illness affecting them as a person? How can we help them? And you can't help somebody unless you can communicate. You know, so narrative-based medicine has been enormously helpful in helping me my communication skills. Yeah.
And it sounds like your experience sort of on both sides.
Yes. Yeah.
As a clinician and as a family member, as a parent.
Yeah.
It's made you very aware of how words land.
Yes.
And that it's easy, you know, sometimes as healthcare providers, you know, to take on like a clinical gaze, for lack of a better term, which is understandable.
Sure.
And sometimes healthcare providers actually need that.
Yes.
But it's given you that sense of how does that land on the patient and the family.
Yes.
If that's the way I'm communicating.
Sure. Absolutely. It's had an enormous impact. Yeah. It's had an enormous impact, really, you know, and really it's about respecting the personhood and the dignity of the person. And then, the most important thing, when a patient comes, like when a patient comes to outpatients to me for the first time, the most important thing that I look at is, is not to scare them. We want them to come a second time. And the communication is so important for that, you know, and that a patient feels able to say their concerns. You know, we know, like, the research tells us that patients think that if a doctor or a nurse doesn't kind of like ask about an area or a topic, that the patient thinks that it's not something they can bring up. So that really emphasizes the importance of our communication skills, you know, and giving people the permission to raise their concerns. You know, it's so important. Yeah. So I just can't say enough how much it has helped my communication skills in narrative-based medicine.
Thank you so much, Miriam. It's been wonderful to get to know you better and to meet you in person and hear the fantastic directions that you're taking all this work in. Thank you for being with us today.
Thank you.
Oh, thanks so much for having me. I really appreciate it. Thank you so much.